Antihypertensive drugs. Antihypertensive drugs are medications used to lower high blood pressure, hypertension. They are classified into several major categories based on their mechanisms of action. Here are the primary classes of antihypertensive drugs. 1. Angiotensin-converting enzyme inhibitors. 2. Angiotensin II receptor blockers, ARBs. 3. Calcium channel blockers, CCBs. 4. Beta blockers. 5. Atrial and venous dilators. 1. Angiotensin-converting enzyme inhibitors. ACE inhibitors, or angiotensin-converting enzyme inhibitors, are a class of medications commonly used to treat various medical conditions, primarily related to the cardiovascular system. They work by blocking the action of the angiotensin-converting enzyme, ACE, which plays a key role in regulating blood pressure and fluid balance in the body. By inhibiting ACE, these drugs help relax blood vessels, reduce blood pressure, and improve cardiac function. Here are some key points about ACE inhibitors. Mechanism of action: ACE inhibitors block the conversion of angiotensin I to angiotensin II. Angiotensin II is a potent vasoconstrictor, meaning it narrows blood vessels, which increases blood pressure. By inhibiting this conversion, ACE inhibitors cause blood vessels to relax and dilate, reducing blood pressure. Indications: 1. Hypertension. 2. Heart failure. 3. Post-myocardial infarction. 4. Diabetic nephropathy. Common ACE inhibitors. 1. Lisinopril, one of the most commonly prescribed ACE inhibitors. 2. Enalapril. 3. Captopril. 4. Ramipril. 5. Benazepril. 6. Perindopril. Side effects: 1. Cough. 2. Hypotension, low blood pressure. 3. Hyperkalemia, high blood potassium. 4. Renal dysfunction. Contraindications: 1. Pregnancy. ACE inhibitors are not recommended during pregnancy, as they can harm the developing fetus. 2. Kidney disease. In certain cases, ACE inhibitors may not be suitable for individuals with severe kidney disease. Monitoring. Patients taking ACE inhibitors should have regular blood pressure and kidney function monitoring. Adjustments to the medication may be necessary based on these measurements. 2. Angiotensin II receptor blockers, ARBs. Angiotensin II receptor blockers, ARBs, also known as angiotensin II receptor antagonists, are a class of medications commonly used to manage various cardiovascular conditions, particularly those related to high blood pressure, hypertension, and heart function. These drugs work by blocking the effects of angiotensin II, a hormone that constricts blood vessels and raises blood pressure. By inhibiting angiotensin II, ARBs cause blood vessels to relax and dilate, resulting in lowered blood pressure and improved cardiac function. Here are some key points about ARBs. Mechanism of action: ARBs work by blocking the action of angiotensin II at its receptor sites, specifically the angiotensin II type 1, AT1 receptors. By doing so, they prevent the vasoconstrictive, narrowing of blood vessels, and aldosterone-releasing effects of angiotensin II. Unlike ACE inhibitors, which block the formation of angiotensin II, ARBs act downstream in the renin-angiotensin-aldosterone system, RAAS, pathway. Indications: 1. Hypertension. 2. Heart failure. 3. Diabetic nephropathy. 4. Post-myocardial infarction heart attack. Common ARBs: 1. Losartan, one of the most commonly prescribed ARBs. 2. Valsartan. 3. Irbesartan. 4. Candesartan. 5. Olmesartan. 6. Telmisartan. Side effects: ARBs generally have fewer side effects compared to ACE inhibitors. They are less likely to cause the dry cough associated with ACE inhibitors. Possible side effects can include dizziness, elevated blood potassium levels, hyperkalemia, and changes in kidney function. Contraindications: 1. ARBs should not be used during pregnancy, as they can harm the developing fetus. 2. Individuals with a known hypersensitivity to ARBs should avoid these medications. Monitoring. Patients taking ARBs should have regular blood pressure and kidney function monitoring. Adjustments to the medication may be necessary based on these measurements. 3. Calcium channel blockers, CCBs. Calcium channel blockers, CCBs, are a class of medications commonly used to treat a variety of cardiovascular conditions. They work by blocking calcium ions from entering the cells of the heart and blood vessels. This action leads to several effects, including relaxation of blood vessels, vasodilation, reduced heart rate, and decreased force of heart contractions. Here are some key points about calcium channel blockers. Mechanism of action. Calcium ions play a crucial role in the contraction of smooth muscle cells in blood vessels and the heart. CCBs inhibit the movement of calcium ions into these cells, leading to relaxation and dilation of blood vessels. There are two main types of calcium channels, L-type and T-type. CCBs primarily target L-type calcium channels, which are found in cardiac and smooth muscle cells. Indications. 1. Hypertension, high blood pressure. 2. Angina, chest pain. 3. Arrhythmias. 4. Raynaud's disease. In some cases, CCBs are used to improve blood flow in people with Raynaud's disease, a condition that causes blood vessel spasms in the extremities in response to cold or stress. 5. Migraine prophylaxis. Common CCBs. 1. Dihydropyridines. These CCBs primarily affect blood vessels and are often used for hypertension. Examples include amlodipine, nifedipine, and felodipine. 2. Non-dihydropyridines. These CCBs have more pronounced effects on the heart and are used for angina, arrhythmias, and other heart-related conditions. Examples include verapamil and diltiazem. Side effects. 1. Side effects can vary depending on the specific CCB and individual response, but common side effects may include dizziness, headache, flushing, swelling of the ankles, peripheral edema, and constipation. 2. Non-dihydropyridine CCBs, verapamil and diltiazem, can also cause heart block and may have more pronounced negative effects on heart rate and rhythm. Contraindications. 1. CCBs are generally not recommended for individuals with severe heart failure or certain types of heart block. 2. They should not be used in combination with some other medications, as interactions can occur. 4. Beta blockers. Beta blockers, also known as beta-adrenergic blocking agents, are a class of medications that primarily block the effects of the hormone adrenaline, epinephrine, on the body's beta receptors. These drugs have a wide range of medical applications and are commonly used to treat various cardiovascular and non-cardiovascular conditions. Here are some key points about beta blockers. Mechanism of action. Beta blockers work by binding to and blocking beta-adrenergic receptors, which are found in various tissues, including the heart, blood vessels, and lungs. There are two main types of beta receptors, beta-1, and beta-2. Beta-2 and beta blockers can selectively target these receptors. The primary effects of beta blockers include reducing heart rate, negative chronotropic effect, reducing the force of heart contractions, negative inotropic effect, and relaxing blood vessels, vasodilation. These actions result in decreased cardiac output and lowered blood pressure. Indications. 1. Hypertension, high blood pressure. 2. Angina, chest pain. 3. Arrhythmias. 4. Heart failure. 5. Migraine prophylaxis. 6. Anxiety and performance anxiety. Common beta blockers. 1. Selective beta-1 blockers. These primarily affect the heart and include drugs like atenolol, metoprolol, and bisoprolol. 2. Non-selective beta blockers. These affect both the heart and other tissues with beta receptors, including the lungs. Propranolol is an example of a non-selective beta blocker. 3. Beta blockers with alpha blocking activity. Carvedilol and labetalol have both beta blocking and alpha blocking properties, making them effective in lowering blood pressure. Side effects. 1. Common side effects may include fatigue, cold extremities, slow heart rate, bradycardia, and dizziness. 2. Non-selective beta blockers may cause bronchoconstriction in individuals with asthma or chronic obstructive pulmonary disease, COPD. Contraindications. Beta blockers should be used with caution in individuals with certain medical conditions, including severe heart block, heart failure, and bronchospastic lung diseases. 5. Atrial and venous dilators. Atrial and venous dilators are medications or substances that specifically dilate, relax, and widen the blood vessels in either the atria, atrial, or veins, venous. These dilators are used to manage various medical conditions, particularly those related to heart and circulatory problems. Here's an overview of atrial and venous dilators. Atrial dilators. Natriuretic peptides, atrial natriuretic peptide, ANP, and brain natriuretic peptide, BNP, are hormones produced by the heart in response to increased atrial pressure. They have vasodilatory effects on the arteries and veins. These peptides play a role in regulating blood volume and blood pressure. Digoxin, while primarily known as a medication that increases the force of heart contractions, positive inotrope, digoxin can also have mild vasodilatory effects in some cases, particularly in heart failure patients. Venous dilators. Nitrates, nitrate medications, such as nitroglycerin and isosorbide dinitrate, are potent venous dilators. They work by relaxing the smooth muscle in the walls of veins, which reduces venous tone and venous return to the heart. As a result, there is decreased preload, the amount of blood returning to the heart, which can help reduce cardiac workload and relieve symptoms of angina, chest pain, and heart failure.